Hi everyone, and welcome back to my channel. So if you are new here, my name is Emily, and my husband BG and I make recovery content for severe anxiety, DPDR, panic disorder, and agoraphobia. We teach on this channel how to desensitize the nervous system and recover rather than simply cope. So today I have a very exciting guest on the channel, and we're going to talk about recovery from long COVID, long vaccine, POTS, chronic fatigue, and how all of this ties into anxiety recovery and what we teach here. So Dr. Robert Groysman is a medical doctor located here in the United States, right outside of Dallas, Texas. His background is in anesthesiology and interventional pain, but now Dr. Groysman is also focusing on the treatment of long COVID, long vaccine, mast cell activation, chronic fatigue, POTS. I'm sure the list goes on and on and on. It will continue to do so. But basically, he is a pioneer and one of the first leading doctors in long COVID recovery, the first in Texas. And he's got a ton of information available on his website, which is covidinstitute.org. I'm going to link that in the description as well as all the information to contact him. But I'm going to let him kind of take it away and give a quick introduction, and then we're going to go into some questions.
Well, you've done a pretty good job.
Good.
I've been treating long COVID since 2020. I guess early 2020, even before long COVID was even known as long COVID. It was just a few symptoms that were cropping up, and since that time, I've expanded the kind of treatments we offer, and we have a pretty decent result with everything that we do, both different kinds of injections and different medications that are combined together, and vagus nerve stimulation has been fairly successful.
That's awesome. Yeah, I just took off my ear clips for the vagus stimulation. I'm like 4 days into that. So definitely going to talk about that one because that's honestly a very cost efficient, like it's like $30 on Amazon for the device.
Well, if you're going to use the TENS, yes, then yes.
Yeah, so it's pretty cheap and easy starting place as far as COVID recovery goes. But I've got a list of questions here. We're going to start off basically with, for people that are not aware of the, terminology symptoms here, what exactly is long COVID and what are the main symptoms of long COVID? And I know that, again, this is all relatively new. So kind of like the current research as of 2023.
All right, well, let's first start with there's no diagnostic test or anything you can do on the blood, or anything you do on imaging or anything else that will tell you if you have long COVID or not. Mm-hmm. There's been over 203 symptoms documented from long COVID or with long COVID. Now, that doesn't mean that everybody has all 203 symptoms. On average, it's been about 55, 56 symptoms, though, per person, depending on person. And there's clusters, people who have more of some versus others. So what is long COVID? You have to have recovered from COVID first. Mm-hmm. And about 4 weeks or more after that, you start developing a multisystemic disease. Now, some people, it carries over from, you've had the symptoms during COVID and it continues during long COVID, but you have to have recovered from the COVID virus itself first. And because it is multisystemic and it involves pretty much every body system that we have. And, if we look at most common things, so let's look at systemic, which is kind of body-wide. Things like chronic fatigue, post-exertional malaise, mm-hmm. Which is being tired after doing anything, even minor and small, and temperature dysregulation. In other words, sweating inappropriately or feeling cold or hot when you're not supposed to, or normally you would not.
Good stuff.
The next the
Yeah.
next one is the most common area is the neurologic, and I could write a whole page on that. But
Mhm.
the big ones are brain fog, issues with concentration, smell or taste loss or abnormalities, memory, short and long-term problems, issues with insomnia, basically sleep issues, neuropathies or pins and needles that develop in various parts of the body. Some people call them vibrations.
Yeah.
Tremors have happened. It's not common, but it does happen. Um, let's see here. Headaches and tinnitus.
Yeah. Okay. And my follow-up question on this one. So I know you have to recover from long COVID or from COVID to get the long COVID. So do you see people that have gaps in time where they're like, they feel back to normal and then it all kind of goes south? Or is it more like they never really get better? Or what does that look like?
I've seen both. I've seen
Yeah.
both. Some people, it just kind of seems like one long infection, but the COVID is out of their system.
Mhm.
And others, they recover and they feel great and they like, okay, back to work, back to normal. And a few weeks later or a month later or 2 months later, they developed the long COVID symptoms.
Yeah, because that's for me. I had COVID. I lost my smell. I still don't have smell, which is why I'm going to see you in a couple weeks here, which we'll talk about in a few. But I developed severe panic disorder, a billion symptoms, like to the point where, and this was kind of when COVID was still pretty new. Long COVID was new. I was a hypochondriac essentially, and doctors were like, "I don't know, something's wrong with you." So I had my gallbladder taken out and I woke up from the surgery and had a million symptoms. But what my theory is that the COVID was kind of already, the long COVID was brewing and the gallbladder surgery was just the stress that my nervous system kind of snapped under. And then kind of looking back, I can see even within that period that I was good, there was a lot of red flags, you know? So we're finding that a lot too, like in this community with the anxiety group. Some people have had it forever. Some people have had it kind of like a few months post COVID, and it wasn't just like they got sick, they never got better. Because a lot of people with long COVID think that's kind of all that it is.
No, unfortunately, like I said, I've seen both, and
Yeah.
I know we just did systemic and neurological, but we still have psychiatric, cardiovascular, pulmonary, ear, nose, throat, gastrointestinal,
Yeah.
dermatologic, musculoskeletal, reproductive, and immunologic. All those are symptoms and body systems that are affected um, in long COVID. Again,
Yeah.
you won't necessarily have every single one,
Hmm.
but you know, if you're asking me
Yeah.
what
Those
are
are
the
like
common symptoms, we have to go by body system. Otherwise, it's too confusing.
yeah, I agree. I know
So,
I could talk for days on symptoms. It's crazy. It's crazy.
so do you want me to go into them or do you want to
I
move on?
think I think that's good for now. I
Okay.
think that's a good start. And then anyone, if you're experiencing anything that's like more, what is this one long COVID, you can always reach out to Dr. Groysman and kind of go
Yeah.
from
Well,
okay.
with 203 symptoms to work with, it's
Known.
quite a list.
Yeah, it's crazy. Okay. So number two, when it comes to additional issues such as POTS and chronic fatigue, are these still under the umbrella of long COVID? And does all of this boil down to nervous system dysfunction or dysautonomia?
Well, if you look at the symptoms that occur with chronic fatigue and POTS, you'll notice some similarities with long COVID. At least a good number of symptoms are the same between these three. Now, including tachycardia with POTS,
Yeah.
and you can get tachycardia with chronic fatigue as well.
Mhm.
I think in some part there is some dysautonomia or abnormality in the autonomic nervous system that occurs with all three. So it's kind of a difficult question to answer. If you never had these before the long COVID, they're
Mhm.
part of long COVID. They're not really a separate entity.
Right,
If
right.
you've never had issues with POTS before, and there's lots of different causes of POTS, the most
Yeah.
common being the neurologic one. But you can also get it from not enough fluid volume and
Yeah.
things like that, or salt wasting. In other words, you're not retaining the salt in your
Yeah.
bloodstream. But if it's just onsetting after long COVID or during long COVID, then it's part of the long COVID,
Right.
including the chronic fatigue. But
Yeah.
they also can occur as conditions on their own, in
Yeah.
their own right, and look very similar to long COVID, but without the smell or
Yeah.
taste, obviously.
Right.
Whereas POTS focuses mainly on the tachycardia, it still
Right.
has a lot of the other symptoms associated with it. And with chronic
Right.
fatigue, it's mainly going to be the fatigue part, but
Right.
everything else, a lot of the other symptoms are associated with this as well.
Okay, that makes sense. And I know, like with the anxiety recovery, we call it kind of like the anxiety umbrella, and then everything's under that umbrella. So
Mhm.
when we approach a recovery, we want people to kind of throw away the millions of problems they have and focus on the one problem. Because when you start to symptom chase, I mean, it could take the rest of your life, you
You
know? So
can't symptom chase with long
yeah.
COVID.
Yes, yeah. So really same concept there. That makes a lot of sense. It's impossible. You can go down all these different pathways and really just spin your wheels and get nowhere, you know? So that
You
makes a lot
fix
of sense.
one problem and something else comes up.
Yeah, exactly. You're never getting to the root.
Right.
So that's good to understand. Okay, so number 3 is long COVID and long vaccine or vaccine injury treated the same way.
The short answer is yes.
Okay.
There's been some myocarditis and thrombotic events. Sorry, something is in my eye.
Oh, no, good.
Uh, um, associated with vaccine, with the
Okay.
COVID vaccine, as well as some reports of Guillain-Barré syndrome, which is an ascending paralysis.
Yeah.
But it's also associated with other vaccines as well, not just COVID. But
Right.
aside from those particular cases, yes, they're treated the same.
Okay, got it. Yeah, that makes sense. Are you seeing people like that had the vaccine? Is this preventing long COVID for them or not so much?
It depends on who you listen to,
Yeah.
um, and which study and which entity is reporting it. So there's supposed to be a modest reduction of long COVID occurrence from the vaccine, but there's also complications and problems caused by the vaccine. So it's a little tough to decide risk versus benefit.
Right.
Obviously, not everybody is going to develop problems from the COVID vaccine,
Yeah, of
but
course.
a large percentage of people, larger than I'm comfortable with, um, just due to chance. So it's going to be up to each individual person to decide
Risk
if
versus
they
reward.
want to do it or not.
Yeah, I agree. Yeah, was that something as you were watching this play out with kind of the vaccines, the vaccine passports, all that kind of stuff? What were you thinking out of curiosity? Because I'm not like for or against people doing it. I think it's their own decision, but it was very weird how it all played out with the for the greater good, everyone must, don't look at any possible negatives and just go for it. It was weird.
Well, look, the thing is that, it's not technically a traditional vaccine like other vaccines are. I mean, the
Yeah,
whole purpose of getting vaccinated is that you don't get sick from whatever agent you're being protected from. But
right,
as we have learned over the last 3 years or 3.5 years, that the vaccine doesn't really prevent you from getting sick with COVID. You can
right,
still
yeah,
get COVID, you can still get sick, you can still end up in the hospital. I know this because my parents just came
yeah,
back from a trip last week and they both had COVID. My mom did okay. She was at home, but my dad had to go to the hospital, and they both are vaccinated,
yeah,
not just once, not just twice.
yeah,
So my point is what are you exactly, what's the goal here? What
yeah,
is the purpose of the vaccine? And I can't answer that.
yeah,
Um, if it's not stopping you getting sick from COVID,
Yeah.
is it stopping you from going to the hospital? Well, maybe not.
Yeah. And it's not stopping transmission, and it never was, right?
Right. So again, my question is
Yeah.
why are you getting vaccinated then? Now, I love the other vaccines. They're fine.
Yeah.
It's
Yeah.
just, I think this one is a little different. And, like
Yeah.
I said, I think people need to decide for themselves,
I agree.
um, whether to do it or not.
Yeah. No, I totally agree. It was marketed weird. I'll leave it at that.
It's actually not just marketed weird. It was marketed by several companies who shall remain nameless, using um, famous actors
Yeah.
on TV and cable
Yeah.
to promote the vaccine.
Yeah.
And all I'm going to do is on the covidinstitute.org website. That's the website I run. I'm going to put all the information there. I advise people to read all the way through, read everything. I put the CDC statement, what they recommend about the vaccine. And I
Mhm.
put in I guess the other side, the case studies and case reports of the reactions, and people can decide, if they want to take the risk, and they think that outweighs the benefit outweighs the risk, then by all means go for it.
Yeah. And I think that's really important. And that's what's needed throughout all of this, because we have information that's swayed one direction. We have information that swayed the other direction. I have my own very strong opinions on it, but it's important for people to be able to look at everything and decide and say, here's all the facts, here's all the truth. Now, what do I want to do? Instead of
Right.
like, do it or don't do it,
Well,
So
COVID and long COVID are definitely politically charged. There's issues with disability, there's issues with employment, there's issues with medical coverage. There's a lot involved.
right. Yeah, that makes sense. All right. So moving on from that, I think that answers that question. So number 4, this is a nuanced question, obviously, but can POTS be cured? Can it be managed? And I guess, I don't know if that's two-part. Is that POTS prior to COVID and POTS after to COVID? Is that a different answer? What does that look like?
Well, if it's POTS before long COVID, I mean, yes, it could be managed. It's typically not cured.
Yeah.
There's multiple different strategies to treat POTS. We're talking about normally to treat POTS, not associated with long COVID, but
Right.
the treatment is very similar if we're talking about POTS.
Mhm.
So things like compression garments,
Yep.
lower half of the body, legs, help increase the blood volume coming up, keeping hydrated, especially making sure that you're taking in enough salt. There's several medications that help with this. One works by retaining more salt. It's a steroid, but it's more of a glucocorticoid as opposed to a corticosteroid, and it helps retain. It works part of the aldosterone system and helps retain salt in your system.
Right.
There's medications that work on the heart and blood pressure. Although in POTS, you technically shouldn't be dropping your blood pressure too much, because
Yeah.
then it becomes orthostatic hypotension instead of
Yeah.
POTS. So the primary symptom obviously is going to be the tachycardia, which is the T in POTS. And one way to deal with it is with a beta blocker or a calcium channel blocker, where you're basically slowing down your heart.
Yes. Yeah.
Okay. The other method is to increase the blood pressure in the lower extremities, and
Yeah.
the midodrine is one of those medications that can be used to help increase the blood pressure. So that's kind of the general management of POTS for most people. Now, if
Yeah.
we're talking about long COVID and you never had any issues with POTS before, there's a good chance it's going to go away once you
Mhm.
treat the cause of long COVID.
Right. That makes sense.
And as you know, there's a few conflicting theories out there on what causes it. Is it immune dysfunction? Is it autoimmunity? Is it a chronic inflammatory reaction?
Mhm.
Is it a thrombotic problem, like with clots? or is it dysautonomia as the primary cause? So I think they're all interlinked. But to know which one is the main cause, and with the others one being falling under the umbrella, that's the hard part.
Yeah.
It's figuring out, which one of those is actually causing and the other ones are consequence of it.
Yeah, absolutely. Yeah, chicken or the egg situation.
Exactly. But
Yes.
yeah, if you treat the cause, the POTS will go away, just like when you treat the long COVID, the tinnitus will go away and the palpitations will go away and the neuropathies go away. And I've witnessed all those.
Yeah. Yeah, that's really amazing. And actually I saw on your website, right, that you also specialize in is it sports medicine?
Yes. So that goes with pain management.
Okay.
Uh,
Yeah, because when I was at Mayo, they also suggested they said I think it's the same concept as compression garments, but basically building like lower body muscle
mhm.
help a lot with
Same
POTS.
idea. Same idea.
Yeah.
Yes.
And that would be the pre-existing like POTS. It's not the
Yes.
COVID. Yeah. Yeah, that's another one
Yeah.
for sure.
But there's no cure per se for a regular
Yeah.
old POTS.
Hmm.
Um, I could say that if it's due, for instance, to diabetes, which is a very common cause of autonomic neuropathy or
Yeah.
dysautonomia, if you control that, if you control the condition, everything else gets better too.
Right. Yep. Yeah,
Um,
that makes sense. Okay. Let's see. So number 6. Okay, so this is a big one. What's the vagus nerve's role in long COVID recovery, and what's the vagus nerve stimulation? And that's what we were talking about in the beginning of this call. So I'll let you kind of take that one away. That's definitely a
okay.
easy one to start with.
So it's a long question to answer, but I'll try my best to consolidate it.
Okay.
In short, the vagus nerve is kind of a special cranial nerve compared to the other
Mhm.
cranial nerves. Not only is it the longest nerve in the body, when they call it the wanderer. That's what vagus means in Latin.
Mhm.
It goes all the way from the brain, and it goes to every single organ that we have in our bodies. And it is responsible for the parasympathetic control of automated functions. So what does that mean? So things like tear production, saliva production, pupil size, the swallowing reflex, and controlling your vocal cords, that's all vagus nerve.
I had different pupils that's so crazy. Like I remember that was one of my first crazy symptoms, and the anxiety component made me freak out about it big time. But the pupil size is what it was. And that
Well,
was,
anxiety and
yeah.
depression are also partly related to vagus nerve function.
Wow, yeah.
Um, so we go to the heart, and it lowers heart rate and the force of the heartbeat.
Mhm.
We go to the lungs, and it changes the size of the bronchi and how much mucus is produced.
Wow.
And it's responsible for about 75% of everything that's digestion related. So everything from the swallowing reflex, it's a lot of jobs.
Yeah.
Swallowing reflex to the peristalsis that moves the food and drink from your throat down through the sphincters into your stomach. If the vagus nerve is not working well, you have gastroparesis.
Wow.
Secretion of acid and bile and pancreatic enzymes, that's stimulated by the vagus nerve.
Wow.
Basically, the peristalsis in your entire digestive tract. Now, there are enteric nerves that are kind of built into the wall of the intestines
Mhm.
that help coordinate a lot of this, but it basically is like a conductor, and they're like the orchestra.
Okay.
So it tells the body when to do what. And reproduction. A lot of the reproductive functions are controlled by the vagus nerve. So
Wow.
a very, very important nerve. Unfortunately for us, COVID damages this nerve or inflames it or thickens it.
Mhm.
That's been shown by multiple studies, by multiple imaging.
Right.
I see this when I do my blocks. I look at the vagus nerve.
You can see it like when I have my block with you in a couple weeks, you can see if it's like,
If it's thickened, yeah.
that's crazy.
You can't tell if it's dysfunctional, but you can tell
Yeah.
if it's thickened or looks abnormal.
Wow.
So we know it hits the vagus nerve. It hits other nerves too, okay? And we know that. That's
Yeah.
why you have the neuropathies. The pins and needles, the pain,
Mhm.
the vibration sensation. We know it does multiple areas, including the ear, which I think is what's
Yeah.
responsible for tinnitus. Some people have issues with swallowing
Mhm.
or hoarseness, or their voice changes. That's all vagus nerve dysfunction.
Would that be so with the ear, um, are you familiar with PPPD? So like the basically persistent dizziness that's not vertigo, kind of that off balance swing
No, I'm
sensation.
sorry, I'm not.
Do you know if like the dizziness could be tied to the nerve?
It's possible. There's a lot of different possible causes for
Yeah.
dizziness. One being blood flow, the others being chronic inflammation in
Yeah.
certain areas of the brain, the third being the dysautonomia.
Okay.
And the fourth, again, it kind of goes back to long COVID. It could be clots or small clots in various areas. Um, so, uh, let's talk about vagus nerve again.
Yeah.
So if the vagus nerve is thickened, if it's damaged, if it's inflamed, it's not going to work well.
Mhm.
I mean, it's just not going to transmit the impulses from the brain and the brainstem the way it needs to. So the functions that the vagus nerve does are going to be lower or not as good as they could be.
Right.
So one of the main functions, aside from everything I just mentioned, it's a lot of work,
Yeah.
of the parasympathetic nervous system as a whole, is the maintenance of tissues, the repair, the renewal.
Mhm.
So if your vagus nerve is not working well and your parasympathetic is not working well, you're technically aging faster than you should be, than your chronological age,
Wow.
because you're not replacing and repairing tissue as things get damaged and have a problem. So all this stuff kind of happens during deep sleep, stage 3 sleep. In fact, it focuses so much on repair and maintenance that it doesn't worry about your heart, your lungs, or your temperature. So everything drops. Your blood pressure drops. Your heart rate drops. Your breathing rate drops, and your temperature drops. And this is happening during deep sleep. So it's like, I don't want to worry about that stuff. I'm gonna fix everything that's broken.
Right. Yeah.
If you're not having a good
Yeah.
parasympathetic
Mhm.
tone, good vagus tone, you're also not getting good deep sleep either.
Right.
So it has a lot of implications. So what does vagus nerve stimulation do? So the nice thing about the vagus nerve is the way we're built.
Mhm.
And while the sympathetic system, you have to basically, go in more invasive with a needle to get to the sympathetic tract, like the stellate ganglion. But the vagus nerve does a favor for us, and it goes to the ear, certain parts of the ear, not the entire ear, not the earlobe, okay? That
Right.
doesn't do anything.
Okay.
But it has both efferents with an E and afferents with an A. So afferents are the inputs. That's kind of where it's listening for an input, and efferents are the outputs.
Mhm.
So a part of the ear sensation comes from the vagus nerve. If you stimulate the efferent, it's going to hurt, because that's what the efferents do. It outputs
Right.
sensation to the ear. If you stimulate the afferents, though, which is what we want, it's going to send pulses down and propagate through the entire vagus nerve, okay, on that side. And that's going to help the function. So if it's not working well on its own, it's like a pacemaker, right? we need to help it out.
Mhm.
Um,
Yeah, that makes sense. And what I'll do too is I will link your video that talks about this, like the whatever was the ultimate guide or whatever to nerve simulation. And I can link that. And I don't know if that already has the 7,000 linked for Amazon on there, but if not, I can link
I
it
think I
too.
have 4 different videos, one
Cool.
focusing on the tens, one focusing on eclipse, and
Yeah.
2 focusing on vagus nerve stimulation in general.
Okay.
Um,
Yeah. I
um,
will find that. I don't know if they have a playlist or not, but either way, I'll find that and link that in there so you guys can check that out. But I like the tens unit. It's literally like 30 bucks on Amazon or
right.
something. Clips are like $10. You put it like here and here, and it doesn't hurt. And I just clip it on and work, you know?
Yeah,
So
but there are some people who have kind of side effects from it, like twitching in
yeah,
the ear or ear pain, or
right.
their eye will twitch, or the eyelid will twitch, or they'll have abdominal pain,
Yeah.
or gurgling, like
Means it's
yeah.
working.
That means it's working, but some don't like
Yeah.
it. And
Right.
some will have extra salivation, but those are the kind of main ones I've heard about.
Yeah.
The majority of people have no problems whatsoever, and it just
Yeah.
works.
Okay.
So let's talk about the parasympathetic nervous system and
Yeah.
why are we stimulating it? So it's not just to increase vagus nerve tone, okay? Your vagus nerve is responsible for modulating your immune system and therefore inflammation. So poor vagus control, poor vagus tone, your inflammatory response will be greater. In other words, you'll have more issues with chronic inflammation, autoimmune problems. This is not just me saying it. There's actually been several autoimmune studies done. They've
Yeah.
treated ulcerative colitis now,
Wow.
autoimmune condition, with a vagus nerve stimulator.
Yeah, that's amazing.
Isn't
Wow.
it?
Our bodies are built so incredible. That's the crazy thing. Like our bodies have so much that are already built in there that are just amazing in itself, you know? Just
Well,
needs a
there's a lot of things that are approved by the FDA for vagus nerve stimulation. Now, they were talking about the internal ones. It looks like a little pacemaker, and they just put a little line next to the vagus nerve and it stimulates it. One of the main reasons for doing this is for depression that's resistant to everything, basically
right.
not managed um, with antidepressants or any other
Yeah.
medication. Another
Mhm.
big one is epilepsy. Again,
Oh,
resistant to medication treatment or anything else. A third one, which is I think a big one, is arrhythmias. There are certain arrhythmias that are treated
it's
just
crazy.
by stimulating the vagus nerve. Now, there's some that are not FDA approved, but have been proven to be useful. And like I said, some autoimmune conditions like our ulcerative colitis have been shown to be responsive. Um, some migraine work has been done showing that it helped with decreasing migraines, and
Right.
a lot of it will be immune or pain related.
Okay.
So just kind of interesting stuff.
Yeah,
Um,
that's crazy. And this actually segues really well, unless you have anything else to say about the vagus nerve. So into number 7, which is what's SGB and how does that work? And then the pros, cons, side effects, all that
got it.
stuff. Yeah.
So the stellate ganglion block is just what it sounds like. It blocks the stellate ganglion. Now, ganglia are kind of relays, basically a collection of nerves forming mini brains, mini relays, however you want to call it. There's 3 main ones in the cervical chain. Okay, and there's a sympathetic tract that basically follows the spinal cord on the side of the spinal canal or the vertebral body of the spine itself. That basically goes all the way from the tippy top to the bottom of the spinal of your spine. And the 3 that are in the cervical area are the superior, which is the top one, the middle, which is the middle one, and the inferior, which is the lower one. I know this one they actually named
Yeah,
easy.
right. Makes sense.
So in most people, the inferior cervical ganglion will merge together with the superior thoracic ganglion, and they will form a stellate ganglion, which is just slightly larger than your typical ganglion since it combines two. This is a very important ganglia for two-way communication between the head and brain and the rest of your body. So a lot of the sympathetic impulses go through there, and the stellate ganglion figures out kind of, does it send it along, or does it send it back? There may be a change to the signal. So there's some information that's being added or subtracted to it. The problem is when you have an overactive sympathetic nervous system. In this particular case, again, chicken and egg. Is it the vagus nerve that's causing the sympathetic overdrive, or is it the sympathetic overdrive causing the low parasympathetic tone? We don't know.
Right.
But the chronic inflammation can set, or the cytokine storm can start the process of a sympathetic overdrive. What fuels it? Maybe the chronic inflammation. Who knows?
Yeah.
But the main issue is that they both sit kind of on opposite ends of a seesaw. Sympathetic sits on one end, and parasympathetic, or the vagus, sits on the other. And by convention, when one goes up, the other one goes down, for the most part.
Right.
So by blocking the sympathetic track, you're letting the system sort of reset, because you're breaking that positive loop that's occurring, and it kind of feeds itself. And give it enough time to basically reset back to normal.
Right. And so this is so you're seeing this definitely for the smell, which I still don't understand how that goes with all that. But what other, I guess, why the smell, and then what other symptoms are you seeing like go into remission after this block?
So it tends to target more of the neurologic and psychiatric, because both are linked to the vagus and the sympathetic nervous system. So and actually it encompasses quite a few symptoms that tend to go away. And I'm not saying that it can't help with others, but these are the main ones that I see over and over again. The chronic fatigue, the brain fog, the issues with taste and smell, and I'll go over kind of what's involved with that. And with the brain fog, obviously concentration and memory issues tend to get better. From the psychiatric part, it would be the anxiety and the depression and PTSD. It tends to resolve those. In a large percentage of patients, not everybody, it does help with tachycardia and palpitations. It also helps with the chest discomfort or the vibrations that people feel. It helps with neuropathies, at least in the upper extremities. It tends to help with pain in the neck or arms or shoulders. The shortness of breath is kind of plus minus. Some people get better, some people don't. But those are kind of the main ones that tend to respond really well.
Right.
And often. Now, like I told you, I've been surprised. I mean, I've had people with tinnitus, it goes away.
Yeah. And this is quickly too. Like this is within what, a couple of days typically?
So the smell and taste usually go back to normal within 30 seconds to a minute of completing the block. But the brain fog and some of the other symptoms can take a day or two.
Which is nothing in comparison to how long people are dealing with all of this. So that's really incredible. And I'll dig a little bit more into the panic side of things in a minute on this question.
Well, do you want me to talk about the smell and taste?
Yeah, talking about the smell and taste.
So, I mean, I know there's conflicting data on this. We don't have an exact, definitive cause or why it works, but it's likely one or two reasons. It's either a blood flow issue that's being corrected by the stellate ganglion block, and that's been documented that the blood flow does shift in the brain.
Wow.
Or it may be reducing some of the chronic inflammatory
Hmm.
reactions that are occurring in that area.
Wow.
Those are more likely one or both of those.
So when I first got the whole smell thing, like years ago when this started, I was told, or maybe I Googled or something, that it's like the olfactory, like there were like something in your nose that was like damaged, you know? And so for whatever reason, I was always thinking that it was just like damaged something up there.
Well, initially, it probably is damaged directly by the virus, just like a
Yeah.
cold virus would damage your olfactory receptors and
Yeah.
some of the supporting cells. Any cold can do that.
Okay.
But it repairs itself. It's not going to stay like
Yeah.
that forever. In a few weeks, it repairs itself and it goes back to,
Yeah.
close to normal, or if not normal.
Yeah. Yeah.
Um,
I'd never even heard of this until I'm not even on TikTok, but my sister-in-law sent me a TikTok of this shot that somebody got in their neck and then they could smell again. And I was like, what? Like I had given up on the
yeah,
smell, honestly. I was like, guess I won't ever be able to smell again.
yeah,
So
yeah.
it's crazy.
But I think
Yeah.
I think that was what was originally thought, but I think later on, maybe in the first 6 months to a year, but after that, I think they realized that it's not a rewiring of the smell, smell receptors, or
Yeah.
rewiring, or issue with damaged olfactory um, receptors. So, and besides, you can't cure that or treat that within a minute
Wow.
without even touching them, right?
Exactly. Yeah, that's crazy. So, wow. Well, that's really exciting. And like I said earlier too, I'm going to Texas in a couple weeks and I'm going to document this. So I'm excited to see you guys see what happens. So I'm really excited about it. I'm like not excited to get shots in my neck while I'm awake or anything, but I won't be too dramatic, hopefully, on the video.
Okay.
Yeah. Okay, that's good. Anything left on the SGB or should we move on to the next topic?
I mean, there's not a whole lot to talk about. I mean, there's 100 different ways to do it.
Yeah.
I prefer to do it with ultrasound because you can see all the soft tissues, and there's a lot of important soft tissues in the area. Your brachial plexus, which are the nerves that come out of your spine and form the nerves of your shoulder and arm.
Mhm.
Basically, what makes you move your arm, that's from the brachial plexus.
Yeah.
And that's very close to where we're going. There's the carotid artery and the
Big one.
jugular vein,
Yeah.
which sit very prominently in the way a lot of times. You have the vertebral artery, which is the artery that goes straight to the brain.
Hmm.
Those two arteries are large. There's a smaller inferior thyroidal artery that comes off the carotid.
Yeah.
That's sometimes in the way. Um, you have obviously the entrance to where the spinal nerves are into the spinal cord, which you
Yeah.
have to be aware of. And esophagus is most of the time going to be on the left side, but occasionally shows up on the right.
Yeah.
And did I forget about the thyroid? It's right there, sitting
Big
around your trachea.
major organ.
Yeah. So
Yeah.
those are all structures that are visible under ultrasound, but are not under X-ray. Um,
So what I'm hearing is you want to go with someone that has an ultrasound that is a professional and yeah, it's not a procedure I think I would like. I'm flying in from Seattle, but I'm traveling. I live in Florida. So like even if there is, I'm sure there's people in Florida that do this. Like I'm going to someone that specializes in this personally. So I think I would recommend others to do the same thing.
well, the thing is you really have to be comfortable with the anatomy and be able to recognize every single thing there.
Yeah.
Um, it's not something you would learn like from a YouTube video or weekend class. You really need to understand this area really, really well because it's so full packed of vital structures.
Hmm.
Um, and a lot of things can go wrong if you don't go into the right spot.
Yeah,
Um,
absolutely. Yeah. So yeah,
um, but
definitely
yeah,
go with a professional. Okay, that's good. So let's see, I'll go back to that. So how long does recovery take? I know this is another like really nuanced question, but people are asking with
recovery
long
from the
COVID.
stellate
Yeah.
ganglion block or recovery from long
Sorry,
COVID?
from long COVID.
So the answer is we don't know. So if we're talking about just waiting it out, I mean, there's people out there who've been 3+ years with symptoms and no resolution yet.
Hmm.
So we don't know if there's kind of a cap or limit.
Right.
Is it going to be gone at 3.5 years, 4 years, 5 years, 10 years? Who knows?
Hmm.
If we're talking about stellate ganglion, I think we've established that a lot of the symptoms go away within that day, and it could be a day or two before you see improvement on the other stuff.
Yeah.
There's other ways to treat long COVID. There's medications, and there's such as low dose naltrexone, for instance, supplements, which would involve things like resveratrol, and CoQ10. I mean, there's
Taking
there's
that
a whole
one. Yeah.
list. Yeah, there's a
Okay.
whole list of them. And that would be kind of supplements, and then you would add some vitamins. Most people tend to be low on vitamin D.
Okay. Yep.
Some people tend to be low on iron. There's
Hmm.
increased consumption and decreased absorption due to
Yes.
the gut dysbiosis that can happen. And B12, it's sometimes plus, sometimes high, sometimes low,
Hmm.
depending on the person. So supplementing those, adding in magnesium.
Yeah. Magnesium.
Um, and like I said, there's other medications and therapies. Kind of depends on what you're targeting. If you're targeting things with thrombosis or clots, adding in things like nattokinase or bromelain may help.
Okay.
Um, and I like NAC as well.
Yeah, I was gonna say Mhm.
N-acetylcysteine.
Okay.
Vitamin D is another one that tends to be low.
Vitamin D.
Um,
Is there like when it comes to supplements and medications? So I did try low dose naltrexone. I'm like day 4 or 5 of that. Definitely like feel like I drank a lot of coffee, which I didn't, but yeah, so I'm just getting that one time. As far as like supplements and medications go, is there like a one size fits all starting point that would benefit anybody? No. So
no,
this is something that honestly ultimately would be best if you're struggling with this to schedule like a consult with you or something.
yeah,
Yeah.
yeah. I mean, some things don't go together, and some things you don't need,
Right.
because it's not really targeting the areas that you're interested in.
Right.
I like low dose naltrexone, but you have to get the dose right. And that may be anything from 0.5 to 4.5. And some people do well with even higher doses, but I tend not to go beyond 4.5.
Right.
It takes a while for low dose naltrexone to work. It's not a
Yeah.
day or week treatment. It could take a few weeks before you
Yeah.
start noticing some changes.
And that's an
Um,
interesting drug. Would you go as far as to say is like that's a drug that it could benefit like many people in general? Just because I was looking at like the oxidative stress and the anti-inflammatory properties and things like that. Like, are there down
I
taking?
tend to use it more for people who have brain issues like cognitive dysfunction.
Yeah.
But it does have anti-inflammatory effects. It's not completely elucidated
Yeah.
what they all are, but obviously this is medication used off label.
Yeah.
Low dose naltrexone is mainly used for opioid withdrawal.
Hmm.
Um, and it has a different function when it's low. It's used in micro doses, small doses.
Right.
But there's a lot of different medications and supplements that you need to kind of figure out, going together, what you
Hmm.
want to include, what you don't want to include.
Right.
And I mentioned gut dysbiosis. Gut health is very important in recovery from
Hmm.
long COVID. Even if you don't have bloating, diarrhea, nausea, or constipation or abdominal pain, it's still useful to take
Yeah.
care of your gut. And the first therapy is going to be probiotics.
Yep.
So what I would recommend is a room temperature stable
Hmm.
probiotic as opposed to one that goes in the fridge.
Oh, okay.
If you're having histamine issues, histamine intolerance, or MCAS, You may need a whole different set of probiotic species that don't aggravate the histamine production.
Wow. Yeah,
Uh,
there's a lot of detail in that.
yeah, otherwise, if you take regular probiotics, it's going to make things worse.
Wow, that's good to know actually, because I've never had great, I mean, athletic greens I can tolerate, but like I've taken some of the more hardcore probiotics and I am hurting immediately. So
And there's a dozen or more species
yeah,
of bacteria that are usually probiotics will have like 5 or 6, between 3 and 5 species. But if you take 2 probiotics and look at them, they'll have different species in them.
right.
Um,
Is there one you recommend to start with?
I don't usually recommend brands and stuff,
Yeah.
but I can tell you that if you're having histamine issues, stay away from anything that's fermented
Okay.
or
Hmm.
ferment generated. So
Okay.
you need to get the bacteria culture that's in a pill form, um, or capsule form, right, through the
Yeah.
stomach acid, because if bacteria touches the stomach acid, it's going to die,
Right.
which kind of is the purpose, right, of having hydrochloric acid there. Um,
Yes.
but we need to get it past the stomach. So
Yeah.
there's 2 ways to do that. One is a capsule that's able to survive the stomach acid and the bile and everything, all the hostile, nasty stuff. And the second is to have a spore-based bacterium
Okay.
culture. In other words, it's kind of in hibernation and it's not
Mhm.
going to wake up until it gets to the right spot.
Yeah.
So if you're doing like a powder or something,
Yeah.
chances are, unless it's spore based, you're
Yeah.
wasting your time, because
Okay.
it's gonna get destroyed in the stomach
Yeah.
with the bile and the acid and the enzymes.
Right.
That doesn't stand a chance.
Okay. Should you expect to feel kind of crappy for a while after taking probiotics? Is there a detox period? Should you expect stomachache, headache, GI?
Well, it's possible to get some side effects or worsening of symptoms.
Yeah.
Making sure this is not a histamine issue, of course, but you're changing the ecosystem in your gut.
Hmm.
So yeah, things are gonna. It's kind of like a war going on, a
Yeah.
battle between the stuff you want to get there and the stuff that's already there.
Right.
So it may not go down quietly.
Okay. Okay.
Um,
I'm ready to push a little harder through that probiotic situation. Okay.
But
Cool.
probiotics again take months and months to establish themselves. So remember, it's not how many you put in there. It's, is there enough nutrition and stuff in there for it to flourish? It has to
Okay.
establish a colony, just like grass planted.
Yeah.
If you don't water it and give it plenty of sunlight and fertilizer, it's just gonna die. And
Right.
same thing happens here. Um, we rely on the microbiome to produce a lot of stuff for us, okay? And the most important stuff is the B vitamins.
Hmm.
Every single B vitamin is produced by our microbiome. Now, we don't absolutely need that. I mean, I guess we can, take it from the outside, or take a B complex capsule or tablet, right?
Right. Right.
But at least in the before times, it was very important because they didn't sell B vitamin complex.
Yeah.
So
Wow. Yeah, the gut's an amazing place. I actually recently saw a study that was on CFS, right? When it came to they had like identified maybe some sort of species of whatever in your gut that could potentially be like causing CFS or contributing to it or something
yeah,
like
I
that.
actually have that study posted on the long COVID studies.
Yeah.
I'll send you a copy of it.
Okay, cool.
There's actually more than one, but this is kind of the main one.
Yeah, I feel like the gut's like the ocean, or they say like the ocean's like 1% discovered or something like that. So
Well, I
it's a
mean,
crazy place too.
it's only recently that we've discovered what we call the gut axes.
Yeah.
And the gut actually talks to a lot of organs. The most important one is the brain.
Mhm.
Two-way communication
Yeah.
through chemical mediators and through the vagus nerve.
Mhm.
It also talks to lungs, the heart, the kidneys, and the liver.
Right.
Um, and by talks, I mean it's communicating chemically. Um,
Wow. Yeah,
you know,
that's really amazing. All right.
so
Well,
it actually the gut in essence, the microbiome, the species of bacteria living in your gut control a lot of what your body is doing, including your emotions, as crazy as that sounds.
yeah.
Um,
Your serotonin, like, what is it, like 95% or something, a huge percentage that's in your gut, right?
yep, exactly.
Yeah, that's another one of those crazy things. Which we could get into a whole other conversation about our food system and how things are set up these days, but we'll save that for
Yeah, I mean, American diet is not exactly the
yeah,
best
conducive to
diet.
perfect gut health. Yeah, absolutely.
I'm gonna send this to you so you have it. My light keeps shutting off.
Perfect. Yeah, that's awesome. Yeah, I'll definitely look into I could link that in this video as well too.
Um,
Okay, so let's switch topics a little bit here to the anxiety, the panic. So how much anxiety and panic are you coming across post-COVID?
it's almost universal.
Yeah.
It's one of the most common symptoms following chronic fatigue and brain fog.
Are you finding that like, is it a combination of the fact that we had to go through COVID and the news showing dead bodies 24/7 and preparing our death, or is it the virus itself, or like a combination, or what?
Well, I think it's a combination of the two. I mean, obviously, if you've had depression or anxiety beforehand, it's going to be worse
Right.
during long COVID. But I mean, a lot of people do get PTSD from the trauma of not only suffering through long COVID, but also seeing all the stuff going on there, people dying, being brought on in body bags and people
Yeah.
on ventilators. I mean, it's traumatic for some people.
Yeah, it is. And there's a lot of people too that I've met that, I mean, to this day will not take their mask off after everything that
Yeah.
happened. And it's terrifying for them, you know?
It's a
And
security blanket. And let me tell
yeah,
you, I'll probably wear mine when I go to the airport. I
yeah.
mean,
It's
I don't
hard.
know.
Like once you start doing it, for many people, it's like it's we didn't even really think about germs that much, you know? And now someone sneezes and I'm like, ugh, and
Yeah,
I'm just
I know.
imagining the video of like the
Yeah, you
germ,
never know.
like it's crazy. So when it comes to the anxiety post COVID and the SGB, so what are your thoughts on the SGB when it comes to like somebody that's in a deep panic disorder? Do you think that that needs to be paired with the lifestyle change, the stress reduction, the behavioral therapy? Like, what are your thoughts on that?
Well, I always suggest with any anxiety, depression, or PTSD to incorporate some psychiatric or psychological discussion or therapy.
Yes.
CBT I like, but there's many others that also work well.
Mhm.
I'm not familiar with every single one of them.
Yeah.
But yes, I do recommend it. I don't know how many people actually listen,
Yeah.
but
That makes sense. And like
and
to be clear with SGB, it's not a magic shot that's going to take away a panic disorder and it's never going to come back or anything like that.
no, it's going to reduce anxiety.
Yeah.
It's going to make you feel more calm. But if you have an underlying panic disorder, it's still going to be there.
Right. Absolutely.
Um,
That's why I kind of on this channel we teach a lot of how to like desensitize your nervous system with your response to the panic, to the anxiety. And it's definitely one of those things where I know myself, and I don't know if you come across this, but people that like want the SGB for smell or for anxiety or for whatever, but literally could not get on a plane, could not go into a doctor's office. They have such severe anxiety. It was hard for me literally to leave my house when this was at its peak. And so I know the thought of getting on a plane would have been impossible. Getting a shot in my neck would have been impossible.
it's actually,
So
believe it or not, it's very well tolerated by the majority of people. Even the most anxious of people have done very
yeah,
well in my clinic.
that's good.
Um,
Yeah, that's really good to know because I know that it can be really hard when you're kind of like super anxious and trying to seek care for long COVID, for whatever. And it's like, it seems almost impossible, like a huge weight. So I think like before, kind of putting everything under one umbrella, whether it's maybe two, I guess, the anxiety umbrella, the long COVID umbrella, and kind of tackling those in themselves so that you can get the anxiety to the place where you're able to kind of go in the correct direction with the long COVID and you're not spiraling on a daily basis. Because something that I learned that's really helpful is just like not adding fuel to the fire, right? It's like, it is what it is. We can advocate for ourselves, as patients. We can definitely seek care. I'm not the kind of person to just sit there and be like, it is what it is, whatever, forget optimal health, forget decent health, really, But there's also a component of sitting there and focusing on it and fearing it 24/7 and fighting it. And we know too, it's like, as we focus on a certain symptom, it's going to grow, right? It's not that it's like all in our
Yes.
head or anything, but that's something that we do teach on this channel, is how to kind of disarm what's happening. It's not making it so that it's not happening, but just kind of accepting it as what it
Well, it's
is.
how you're reacting to what you're feeling.
Exactly. Yeah. Because even with reaction, right? It's like, if we're, say we're having panic or even just these symptoms that are chronic, right? When we're adding like all of this fear, all this extra focus, whatever, it's like we're signaling to our brain that we should keep the fight or flight system turned on, right?
Right.
And so it's like, how are you ever going to recover if you're
Yes, it
all,
actually fuels the long COVID. Yeah.
oh, really? Yeah. So
Yeah.
response itself could fuel the long COVID.
Well, this has been proven with people getting out of their situations for a little while, usually going on a trip, and their
Yeah.
symptoms completely resolve. And
Yeah.
when they
Because their mind.
return, in a couple of days, they come right back, same as before.
Yeah, isn't that crazy? And that's why, like, I know there's definitely a line between I can do something and it's miserable and I literally can't do something. And I think a lot of people with the long COVID can't put everything in the I can't do it. And it's like, you actually can. Like, you can let the symptoms be a really horrible, loud backseat driver, but they don't have to drive, right? And I'm not talking about like heart symptoms or something that's like truly serious and you shouldn't be doing X, Y, or Z. But it's like, there are so many things that you can kind of like get back into your normal life with the symptoms in tow and realize that like, this is our life and we have to live our life. And we can't just put everything on pause because it has been years, and like, we can't live it perfectly for sure, like with the symptoms, but it's also like, we can't just sit in our bed and stop life for
Right.
years.
I mean, you can't stop living. And that's my point, is
Balance.
it may not be desirable or comfortable, but you still got to go out there and do what you got to do.
Yeah, make the most of the situation as you continue to seek care and as you continue to, advocate and just really meet with people like you, I would say. And like, this whole conversation's actually been kind of mind-blowing because I didn't really know like what this combo would be like, but you're like a wealth of knowledge. Like, I would say I'd be very comfortable to seek care with you for anyone that's struggling with this.
Thank you.
Yeah, absolutely. And I know you said too, you weren't like super big on the social media when this first happened,
I
but
wasn't
it's
on social
actually,
media at all. I mean, I was in my own little world. I was
yeah,
taking care of my patients, and it wasn't until a couple of months after that somebody I know clued me in kind of what was going on social media. And I thought it was kind of a few isolated patients, not millions of people
yeah,
suffering with this. And it really opened up my eyes. And that's the reason I started this group,
yeah,
was because I noticed pretty much, if you look through the Facebook landscape, there's really three kinds of groups. The support groups, which is, complain and unload and, just get the load off because you're sharing, you're
right.
suffering with others who are suffering too.
Which is unproductive in the long term. Yeah.
You have the one-offs, which I call the I found the cure group.
Mm-hmm.
Um,
Sales
and
pitch
yeah,
group.
yeah, you name it. I've seen it as a Facebook group, and I forget what the third one was. Um, but anyway, I didn't see any treatment groups. I didn't see anything that looked at everything out there what's legit, what's not legit, what is likely to work, what's not likely to work, what are the mechanisms behind it. So that was kind of part of the reason I started the group. The others was, stopping the con artists, and there's a ton of
Mhm.
them that take advantage of, desperate people.
Like
And
microdosing or whatever you see out there. Yeah.
yeah, and there's a lot of therapies out there that target people. It has no chance of working whatsoever, except by placebo effect.
Mhm.
But people still spend money on it. But all I can do is warn, if somebody still wants to do it,
Mhm.
I mean, what can I do? Some of them are harmful though.
Yeah.
So some of the therapies are harmful and not just cost you a lot of money, but also potentially can do damage.
Yeah, I know. It's really scary. And I love what you said about your group because that's literally the same reason we have a Facebook group as well for the anxiety. And the internet's a deep, dark place.
It
And
is.
like if you don't have people corralled in a productive group, it's like I would tell people too, it's like once you find your group for long COVID, for anxiety, for whatever it is, leave all the other ones. I'm not like serious, like find your group and commit to one recovery path. And if it doesn't work, then find another recovery path, right? But it's like when you're going in a million directions and you're hearing from all these people who haven't recovered, honestly, like, telling you that it's never going to work, telling you, oh, try this, try that,
Well, that's
you
the other problem is a lot of people, I ask people once they recover to please remain in the group, but a lot of them still
know?
go.
Yeah,
But who actually remains in these groups? The
exactly.
people who did not recover, I mean, it's going to be a skewed. So
Yeah.
a lot of times, they'll ask a question about a treatment or something, but who is in this group?
Hmm.
People who tried a lot of these treatments and didn't get better.
Yeah, yeah,
Um,
exactly. That's so
so
true. Mhm.
yeah,
Yeah, and it's kind of like reviews, right? It's like when you look into reviews for like medications and things, you're typically going to see the people that are like either the most positive or the most negative, and you're not going to see the normal people that are just living their life that aren't writing
right.
reviews or posting about symptoms or whatever. So that's really good to take into
But
consideration.
at least my group, I know there's a lot of people who did recover that still stayed in. Um,
Yeah,
but
I'm in a ton of COVID groups, and yours is the one where I left all the other ones and was like, okay, this one makes a lot of sense, and I'm gonna go in this path right now and quit all the other crap out there that's like not helpful.
well,
So
I'm on a new trail right now that I'm very excited about that I was planning to talk about during my last week's podcast, but didn't get a chance to. But it's referring the alpha 7. I know it's a mouthful. Alpha
I know,
alpha
I know.
7 nicotinic acetylcholine receptor.
So like the nicotine
Um,
patches, or what do you?
no, well, that's part of it. That's
Okay.
part of it. But I think I found the link with vagus nerve stimulation, nicotine patch, and stellate ganglion block, and maybe even ivermectin.
Oh,
Um,
interesting.
so I'm kind of really excited about this. I'm still kind of reviewing it, making sure it makes sense.
Yeah.
But nobody's made the connection before.
So you're
Um,
saying like kind of like what do all these have in common, basically?
yes,
Wow, that's
yeah,
really
and the
interesting.
common mechanism by how these all work.
Wow, that's so cool. Oh, I'm so excited to hear that. And again, this is why these groups are important. Like this is like a real doctor that's giving you information. This is not somebody that's like just created a Facebook group and wants to
Right.
talk about COVID. Like this is like a very guided path to recovery. Obviously it's not a straight path, but it's at least a path. So
Yeah, I mean, we had our growing pains in the beginning. This group is 11 months old.
yeah.
Um, and in the beginning is, who are you? Who are you to tell me this and that? And I'm like, well, I'm the guy that treats long COVID. Um,
Yeah. And that's a mindset thing. And honestly, people like that too. Like if you have a mindset that you're never going to recover, you're never going to recover, and I'm not saying to
ah,
recovery into
this reminds me
existence.
of the 22-year-old we had. He
Yeah.
was so down. I mean, the guy, we did a right side and he didn't get a good result.
Right.
And he was so down and he didn't want to do the left side. And um, we kind of talked with him about it, and he finally did, and he had a profound response on the left.
Yeah, I mean, it's
Um,
you gotta just keep going. And I will tell you what, if I have the block and nothing happens, oh well, I tried it, you know? Keep on living my life. Why am I gonna sit here and dwell about how much my life sucks now? Like it's fine. No loss, no gain. But I am excited.
but it does help most people, not everybody, but it does help most. Um,
Yeah, it's that's one of those things too. And we'll leave it at this and then go with the last question. But it's like in America, especially because you're from Ukraine, right?
yes,
Yeah, that's my dad's side of the family is from Ukraine actually. But
nice.
yeah. So with America, it's like we're so hardwired towards going away from discomfort and not being able to tolerate really anything, but especially discomfort. And that's why it's like on this channel, like with anxiety, it's so hard to for Americans to like recover from this because they can't just really sit with discomfort. And so like with long COVID too, I'm sure it's hard. It's like we want to try something, we want to work immediately. We want the quick fix, the
I know,
magic
but
pill.
unfortunately, except for the SGB, there's really nothing that works
Yeah,
immediately. Although you'll hear isolated reports, people with
right.
ivermectin, people with the nicotine patch.
Yeah.
I mean, sometimes have like a miraculous recovery, but it's not the
Yeah.
norm.
Yeah, it's not the norm. And so it's like being able to be resilient and persistent and just kind of like make the most of your life while you continue to try things and not let it rule your life, I think is really important to learn, which takes time and failure, which is fine too. So all right. So final question. How do you find a long COVID doctor? How can people work with you? Do you telemed? Do you accept patients everywhere, US, out of US? What does that look like?
We accept internationally and everywhere in the US. Keep in mind that you can't really use insurance for these. Now, if you're local and you're in Texas and you want to come into the clinic, you may be able to use insurance for the office visits, but not for the block. And that's not because we don't accept it. It's just because insurance hasn't deemed it worthy enough to be compensated for.
Yeah.
Um, but in short, we have a online contact form
Mhm.
on covidinstitute.com. And if you press contact us, it'll bring you to a contact form where you could fill in your information. And there's a couple of visit options. If you're not sure, don't check anything off. If you're local to, if you're within the US, if you're not international, you're done. We'll contact you through your cell phone, through a text system, and once we determine which appointment you want or need, we'll set up a similar to Zoom, but it's HIPAA compliant system. If you're international, our phones don't accept international calls, so I had to come up with an alternate system. We have another number, and it goes through an app called Signal. And that's very similar to WhatsApp, except WhatsApp is being difficult with a voice over IP number
Mm-hmm.
that they won't accept. So I went with Signal, which works pretty much identical to
Okay.
how WhatsApp works. It's available on Android, iPhone, and even PC. Once you set up your account, you just add our number and the same conversation takes place that way. And once everything is done, we do the televideo call through a platform called doxy.me,
Mhm.
which works over the internet or phone. And we get video and audio and get everything done. That's basically it. But yeah, we can help pretty much anywhere in the world.
That's awesome. And I will link your website and everything, contact form in the description to this video. But yeah, I mean, if you're meeting with your primary doctor who may or may not even believe in long COVID, which I mean, at this point, hopefully everyone kind of does, but I have found,
Actually, there's still a lot of gaslighting going on.
yes,
So just remember, just because it says long COVID clinic does
yes.
not mean that they treat long COVID. I know it sounds weird, but a lot of them are going to do a lot of testing. They'll draw a bunch of blood, 20 tubes of blood, and they'll get imaging, maybe
Mhm.
some other tests, but they're not actually offering a treatment for you. So, okay, now you have all this information. Now what?
Yeah.
A lot of patients come to me and they're like, well, I went to this place or that place, and yeah, they tested you, great, but what are you doing about it? Long COVID is not just about diagnostics, it's about treatment too. So if you're not treating, don't call yourself a long COVID clinic, you
Mhm.
know? Um,
That was my experience. And like I said earlier, it's like all these pieces to the puzzle, which by the way are very expensive and time consuming pieces to obtain. And then nothing ever gets put together. And then I go to my primary and they're like, I don't know, who knows? So it's just like there was no like real true help until, I met with you, and now it's okay, this is someone that's going to take all the pieces you have, take some new pieces, put it together, and then move forward with a plan, and not just like, oh, you have high inflammation, you
yeah, but
know?
what do you do about it? I mean, people go to long COVID clinics to be treated, not necessarily to have a bunch of blood work drawn.
Right. Which is
So,
great for research,
I'm
but
sure you want to know what's wrong and you want to see that lab be high or low. But
mhm,
bottom line is you want to get better from where you are.
yep,
Um,
absolutely.
and these long COVID clinics, I mean, they have a six week or 8 week wait time, but
Mhm.
they're not telling these people that all we're going to do is test you. We're not really going to help you.
Yeah.
Um,
Which again is great for research, but not very great for your life. And
well, it's not, it's
yeah,
great for lab work, but that's it. But what actually are you treating there or doing anything? And a lot of them don't.
yeah.
Some do. There's a couple of primary care docs that do treat.
Mhm.
But a lot of these clinics don't.
Right.
That's the feedback I'm getting from
Oh,
patients
I
who come
agree.
see me.
Yeah.
So I don't know if that's actually true or not, or how widespread that is, but I've heard it more than once.
Yes. No, it's 100% true. I had multiple doctors here. That's why I ended up at Mayo, even telling me POTS wasn't even like real, it wasn't even a thing. It's a rule out diagnosis. It doesn't like really exist.
It actually is not a rule out of diagnosis. It actually has a
Table
diagnostic
test.
criteria with the
Yeah.
TIL table, and it's a real diagnosis
Yes.
and it's treatable.
Yes. Yeah.
Um,
It's it's crazy. Again, medical gaslighting, that could be a whole nother talk in itself, but
yeah, yeah.
cool. Well, I really appreciate this. This was super beyond informative and awesome. And if y'all have any questions for Dr. Groysman, leave them in the comments. And also, more importantly, contact him via his form, schedule a consult, and kind of just go from there. But stay tuned for my video on the SGB. Hopefully, it goes well. But I will post that. And if you are interested in more recovery content specifically for anxiety, then please subscribe to this channel, and I will be posting more soon.
Yeah, I don't tackle anxiety like you do. So, but I'm putting a lot of information on the covidinstitute.org website
Awesome.
regarding POTS, regarding MCAS,
Nice.
anything new that's coming out that I think is important, I'm adding to it. Like I said, I really want this website to be the leader in long COVID across the internet.
Yes.
And I know there's some decent websites out there, but again, I just want this to be like a information gathering place where people can go and get some questions answered. Um,
Mhm.
if it's on midnight and I'm not available.
Right. I don't know. You answer pretty late sometimes.
Sometimes, yeah.
Yeah. Okay, very cool. Well, thank you again. I really appreciate it. And I
Yes,
hope
thank
this
you.
was informative for everyone.
I hope so too.